What's up, gentlemen? My name is Junichi, and I am a physiotherapist with a specialization in men's pelvic pain. If you've been searching for the correct way to activate and recruit your pelvic floor muscles, then you don't need to look any further. Pelvic floor recruitment is a critical skill that you need to learn if you're struggling with things like urine leakage or erectile dysfunction. And by the end of the video, I want you to feel confident in your ability to consistently recruit your pelvic floor so you can get one step closer to living your normal everyday life. First, your pelvic floor is a group of muscles that run from your tailbone to your pubic bone. We all have them. Even men have them, and they're responsible for doing everyday things such as urinating, defecating, ejaculating, and they act as a hammock to support our intestinal organs. As mentioned, good pelvic floor function is particularly critical when we're trying to address urine leakage. Keep in mind that if you're watching this video and you've had a surgery to remove your prostate gland known as a prostatectomy, your pelvic floor is going to look vastly different from when it did prior to surgery. So let's get right into the technique. To understand if your pelvic floor is contracting correctly, it is best to palpate them using your hands. To do this, you want to be seated, just like how I am here, and you want to take your fingers and place them directly on your perineum. Where is the perineum, you ask? Bear with me on the details because it's important to get direct contact on the region that you're trying to recruit. You want to take your fingertips and place them directly on your skin underneath your pants, and you want to find the spot between the anus and the testicles. This region should feel like a soft bit of skin and muscle tissue where you can gently press your fingers into. With gentle to moderate pressure, you want to gently place your fingertips on the region until you feel a little bit of tissue resistance. Then, you want to do one of the following 3 cues. 1. Visualize that you're in the bathroom and you're gently stopping the flow of urine. What you want to feel is a gentle contraction at your fingertips, right directly where you're pressing, and you want to hold that for 5 seconds. So if you want to do it with me here together, I want you to hold onto your perineum with your fingers, gently think about stopping the flow of urine, and count 1, 2, 3, 4, and 5, and then rest. Keep in mind that when you're first learning, even a small flicker of muscle resistance is actually a positive outcome. And if you're not having any success with this, I want you to move on to the second visual cue. With step number 2, I want you to think about you walking into a frozen cold lake and that you feel the water hitting your legs, your thighs, and as it's traveling up towards your hips and to your testicles, I want you to feel like your testicles are rising while you're contracting your pelvic floor. So again, with contact with our hands, we place it on our perineum and we think about that cue. 1, 2, 3, 4, and 5. And if you're not having any success with either of those 2 visual cues, I want you to think about the last one where you're trying to think about contracting into your pelvic floor, visualizing your penis, the length of it is actually coming into your body. So as you're contracting, hold on to your perineal region and count 1, 2, 3, 4, and 5. One of these 3 visual cues should allow you to get your brain to connect to your pelvic floor, again, even if it's just a little bit of a flicker. If you're having a hard time with this, sometimes it's preferential to be on your back and feel your pelvic floor contracting that way, because then we don't have the weight of the abdomen and the abdominal viscera getting in the way of our pelvic floor. And sometimes placing your feet up against the wall can actually help you contract it even better. Now you want to do these 5-second holds for 10 repetitions, 2 to 3 sets, a few times throughout the day. Remember, this is going to take an incredible amount of mental focus, so I want you to really practice this, and even if you feel a flicker of that muscle recruitment, that's still considered a victory. Also keep in mind that quality repetitions is absolutely critical, so I want you to try to get up to 10 repetitions, but if you feel like you can't get that pelvic floor to contract after 4, then I want you to stop, because then I don't want you to experience these co-contractors recruiting when you're supposed to just recruit your pelvic floor. And what I'm referring to is what's considered a bad repetition, where you're bearing down on your pelvic floor rather than gently recruiting it. And that looks like the abdomen pushing out and you're straining, just as if you were sitting down on the toilet. We do not want that feeling of straining in our pelvic floor training, and we just want to feel nice, gentle recruitment at that level of the perineum. As men, we are often visual learners, and the gold standard for assessing the pelvic floor function is done through real-time ultrasound. This is a biofeedback tool that allows you to see the pelvic floor muscles working in real time. Generally, it's the best and most non-invasive way to accurately assess what your pelvic floor is doing. And on the screen, you're able to see the pelvic floor muscles contract because you can see the bladder begin to elevate, and that's how you know your pelvic floor is working optimally. And so if you're a man who's really struggled with recruiting your pelvic floor muscles, I'd highly recommend you see a physiotherapist who specializes in men's pelvic pain. But of course, try these exercises in the video first. So that's all I got for you today. Strengthen, practice some more.